My name is Megan O. I got diagnosed with like the underbite and stuff when I was around like 10 years old, I think. But my parents thought that I would grow into it and my jaw would just, like my upper jaw would just go back to normal. I started seeing orthodontists pretty like young, like around that age, but then I started seeing more orthodontists when I was around 14 or 15. Many times they were just gonna use like aligners or braces and rubber bands to just tilt my teeth backwards sort of. And I mean, my parents were for it just because they didn't want me to get like the underbite surgery, because they thought like I was young and that maybe it would grow back, or that like if it did go back I would have to go undergo another surgery, and they just thought it was too extreme. So I found a lot of finally when I came here and they were like, you need surgery or else we're going to use this like crazy alternative, I was all like, I'm just going to go for the surgery, because like it would fix the problem and it wouldn't be tilting my teeth and it wouldn't leave me with any weird complications if I ever did want to get the jaw surgery when I was like older and like, you know, when I'm done with college and stuff. So so I'm 17 years old now, but when I first came here, I was probably 15 or 16 when I got a consultation, and then I was 16 when we actually decided to get like my braces on and stuff. I think this was about 11 months ago, and yeah, I'm really happy that I only had to get braces for less than a year because I wanted them off before I like went to college and stuff. I guess I was excited that I was finally going to get some sort of treatment, because like I've probably seen every single orthodontist in Issaquah, like Redmond and Sammamish area, and everyone had different opinions, but it was always either let's do a weird alternative, or it's like we're not touching you because you need to get the surgery. And I was kind of scared for the surgery at first because it's like a major surgery, and I was afraid about how they were gonna somehow crack my jaw and like move it backwards. I saw 2 surgeons prior to like coming here, and both of them said I had to wait till I was 16, but it was nice to finally get it over with, because like seeing all the orthodontists and having to go through the same x-rays and like pictures, it was nice to finally. When I first met him and all, it was like he showed me like a 3D like simulation of it, and I felt a lot better about it. At first I didn't think my underbite was as bad, because I just thought like, okay, I can't, like my lower jaw wasn't super extended where it was super obvious. I had a really like, my jawline was pretty long though, and I never was able to like feel the back of my like lower teeth. So like after my surgery, that was like the first thing I was doing, and I was like telling everybody how I could finally do that, and it was like silly. But overall, like I think actually seeing a surgeon who like told me about like the severity of the situation and how like rubber bands isn't going to help, like using headgear at 16 years old as a girl who's past her like growing phase, like it's not going to help. So it finally got me to like realize like I do need the surgery. It's not just like an elective like fun thing. And I mean, I would later have to explain to everyone why I was getting it, and it wasn't like, oh, I'm not trying to get like, I wasn't getting plastic surgery to make my jaw look prettier. It was because like I actually needed it so I could bite correctly. I guess it was a lot more like, I mean, his actual like clinic down in Seattle across from the hospital, it was like, it felt safe, I guess. Like he explained everything normally. It wasn't like a 16-year-old getting a jaw surgery was like I got it like 4 days after I turned 17, but it wasn't a huge like mind-blowing experience. He told me about how a lot of other people get it and how it's better to do it when you're younger, because like the recovery time will be like faster and all, and that like I'm not gonna have to be in a dog going and like taking off like a month of work because of like puffy cheeks. I was overall comfortable because like he told me a lot about how the recovery would be and how I'd be able to eat like maybe 5 days after like solid foods. And also I guess that was pretty comforting about really hearing about the recovery and what I would be going through. I would recommend him, yeah. Also, like I know that my orthodontist like works with him, so like that's like why we chose here, because we liked him as a surgeon. Of course, we wanted to make sure there was like a good relationship between my orthodontist and like my surgeon, and that like he was a good surgeon. And yeah, he was really comforting, and he like knew what he was doing, and he did it a lot. So overall, like I was really comfortable, and I wasn't too afraid. My parents were afraid because like it was their kid going through surgery, but like I wasn't personally super afraid. I was scared of the IV, but that was about it. Yeah.
That's good.
I had to wake up like really early, I think 5 a.m. or so. They told me I could only drink clear liquid, so like I think like water and like apple juice and stuff, and I shouldn't drink an hour before surgery so that nothing like happens and all. But I thought it was going to be a lot scarier. Like, I was going to have to show up, they were going to like admit me, put an IV in me, roll me around the place and do fancy scans or anything. But I just like a nurse, I just waited in the waiting room for a bit, and then a nurse took me in, and then she just like, we just filled out a little paperwork and all to make sure like I'm the right person and all, and then she just like checked my vitals, got me into a gown, and then I mean she was comforting me a lot about the IV because I was really scared about it. But like we just casually walked in, I went on the table, and then I was really afraid about the IV. The anesthesiologist, he met me prior to the surgery, so in the pre-op area when I was like hanging out with a nurse, and then he like asked me how I was doing, asked me if I was still scared about the IV, which I was. So then they gave me some laughing gas, and then like I was still really scared, so then they ended up just giving me this gas, and then they played like music I liked so that like it would calm me down, and then it was like I was asleep and then I was awake. Like I didn't dream or anything. It was just like a bunch of time just like went past. Then I woke up in this post-op area, and I had like I remember having something like a tube in my nose or something because there was a lot of like blood and like mucus. Like that part was maybe like the only like gross part of the surgery, really much like blood and stuff that's like in your mouth, because I also got my wisdom teeth removed, like my upper one, so like it was nice to get that out of the way too, so I don't have to go through that again and another IV. But I woke up there and I was already talking to my nurse because I thought like I liked her lipstick, so I kept talking to her. And I mean my teeth were like pretty, they were rubber band together. It wasn't like wired shut. I thought I was gonna wake up and look like the Terminator in my mouth, and I wasn't gonna be able to like I thought I was gonna be like or anything, but like I could talk and stuff. And my nurse was like, you don't have to talk, but I was like, I wanted to talk because I mean I was just sitting there and all, and my nurses were nice. We got me to my bed. I was pretty dizzy, not really dizzy, but like I was just like sedated. Just I drank a lot of apple juice, and they would like feed me with a tube and stuff, and it was like it wasn't as bad. I was scared I'd have to get like my something down my, I thought I was gonna have to get like that tube down your nose where it goes to your stomach, and that it would feel gross and stuff. Overall, it was pretty easy, and eventually the sedation went off, and then I was out, and they wheeled me out of the place after a day. So I stayed in the hospital from 5 a.m. I think, I don't remember what day it was 5 a.m. and this one day in the morning, and then the next day I was out by 2 p.m. So it was just like
one night.
Yeah, one night, and it was really simple. Then I just like went on with my day and got a lot of rest. I would have to sleep on a reclining chair so that all the pressure wouldn't like stay in my jaw and like my face and all. And then I remember on my 4th or 5th day, those were like the worst days. Like after my surgery, I thought I was really gonna be like full on chipmunk mode and like super bruised up. It was only slightly bruised, but then like as the days passed, it would get a bit worse on like the 3rd, 4th, or 5th day, and then the 5th day it started going down, I think. And then I would have to like ice and like use a jaw bra and stuff to like keep the ice there. But like I think I saw you guys after 4 weeks after my surgery. Yeah, like there was a bunch of time I literally just sat home, ate soup, and I mean I think by the 3rd day I was getting annoyed that I had to eat with like, you know, like a little tube. I just went fine with like ibuprofen, and I was able to take pills because I would like put it in my mouth, close my mouth, and then I would like do that. So I found ways to like adapt to it just because I was tired of having my parents have to like feed me, and like eventually I would eat in front of the mirror and stuff so I can make sure, because my lower lip was really like numbed out. It was like almost, I was playing with it, it was fun almost, and like this area would be really numbed out, so I didn't feel any pain. It was mostly just like pain here, but it felt more like a soreness, like a pinch, kind of like that sort of. I don't know the opposite sensation left in my like my lip and like my chin and all, and it's pretty great. But I think the numbness was like, it was good because it was able to help me like track my recovery. Like when I could start feeling a lot more, at least I would know I was getting better. And even though when I would look in the mirror I'd be a chipmunk, but at least I would know it's getting better. I think after 2 weeks the swelling was like a lot, like it went a lot down. I could go out and I would just have to cover my face like this, and no one would really notice. From the side profile you could kind of tell that there's like little like kind of like bumps on my face, but not like, you know, like bumps, but it was just puffy from the side, so I kind of looked chubby.
Can you come a little closer to the camera and turn to the side so people can see the side of your face? Just like yeah, and now turn back to the camera. Can you smile and come a little closer and show your teeth?
I think, like, if I had to tell someone else I was exactly gonna, like, go through this, I would just tell them to, like, make sure that, like, it's, like, I mean, honestly, like, it wasn't really scary. Like, the scariest thing people think about surgery is, like, being in the hospital. It was one night. I thought of it as a cool sleepover with, like, the 3 different nurses I was going to be able to meet and stuff. It really wasn't scary. It wasn't even, like, I didn't really feel like I was in a hospital, because all I remember was being in the waiting room, like, pre-op, the surgery room, then like post-op, and then they wheeled me out, and it was like fun getting like wheeled out on a bed and all. But I think the worst thing about it, like the scariest thing about it, is just like recovering and looking like a chipmunk, but you'll get a lot of good photos of it, and it's like, it's really fun being able to swipe. Like, I took a picture of myself every single day for the first 30 days, and I took some after a week, and it was really nice being able to see the progress and how your face doesn't change too dramatically. I think my chin looks slightly like smaller and all from from looking from here and stuff, and from the side. I mean, my mom was scared that they were gonna take out my entire jaw, and that I would literally not have a jaw. So she was really worried about the cosmetic experience about it. But like, I don't think too much of me looks different and all. But I think it's just like, just make sure you have like a support system. And like, today we're getting my braces off, and then I'm going to be put in aligners so that I won't have to like come in I won't have to fly down from California, which is where I'm going to college in the fall. I'm getting them off today, so I'm excited about that.